Hi, everybody. I know people are kind of in the process of logging on. We're so happy to have you all here. My name is Russell, and I'll do introductions in a moment. I want to have a few quick announcements. First of all, I have one quick announcement is that thank you all again, those of us on our listserv, for letting us know what topics you're interested in hearing. And this is one of the topics that you all had mentioned was a real priority for you all. So thank you for giving us that feedback. This will be our last webinar of this year. Well, not this year, this academic year. We'll begin back in August, and we'll probably send out a survey pretty soon just to ask you all for more topics that you're interested in for these monthly webinars, again, that will start back in August. And we'll let you all know sort of what that schedule is from there. So please let us know what topics you'd like, and we'll do our best to find experts who can present on that. I have a few other announcements. Today's webinar will be recorded. We do have a YouTube channel. I have to look at Jessica because I don't even know barely know what YouTube is, aside from I chase my children off it all the time. It'll be recorded. Yeah, Jessica will talk a little bit more about that YouTube in a minute. Please be on the lookout for any communications via our listserv for when today's webinar will be available. So just keep in mind keep abreast of our listserv. I think that's basically it. Do you have any quick announcements before I then do the?
No, and I just want to say thank you to everyone for joining us today. I am Jessica Zavala, and we are so happy to have Dr. Juanita Martin with us. And as Russell mentioned earlier, this is a topic certainly that we have heard from you all on our listserv, and we are very excited to bring forward this information for you today. So once again, as Russell mentioned, our YouTube channel is now available, and we will upload all of our previous recordings on the YouTube channel as well. So if you're familiar with YouTube, you would just go on there and look for the Ohio Program for Campus Safety and Mental Health. It is a public channel, and so we will also send out the link to that YouTube channel, as well as any other relevant resources that would become available based on the presentation today. So thank you again.
So without further ado, Dr. Juanita Martin, and by the way, Dr. Martin has been my mentor, my supervisor, and is now my boss. So a lot of appreciation for Dr. Martin being here. Dr. Martin is Executive Director of Counseling and Accessibility and a clinical psychologist who works at the Counseling and Testing Center at the University of Akron. Dr. Martin will discuss information regarding African-American students in college counseling, some best practices for addressing the mental health needs of African-American college students, and talk about some efforts from the University of Akron Counseling and Testing Center. So without further ado.
Well, thank you. Thank you for that nice introduction. And thank you to the Ohio Program for Campus Safety and Mental Health for allowing us to talk about this topic. I'm going to try to get 3 areas. We're going to first talk a little bit about college student mental health, general service demand, and working with a diverse campus population. Secondly, we're going to talk a little bit about addressing mental health needs for African-American college students in terms of some factors around therapy and counseling. And then third, we'll talk a little bit about what's been going on at the University of Akron Counseling and Testing Center. And if we have time, just briefly mention some national recommendation strategies that are out there. College, exciting, a time of transition. And so, especially for traditional age students, we do expect students are going to have some kind of developmental concerns. Certainly there are going to be academic concerns. They may be trying to learn how to study for the first time for real. They're trying to get involved in terms of interpersonal relationships. Finances are a big concern at this time, especially as many students are getting loans, they're working, etc. So we expect certain developmental concerns to occur. But what we are finding significantly is that there has been a significant increase in college student emotional distress. And regardless of the area that we look at in terms of surveys, say from the National College Health Assessment Survey, the Center for Collegiate Mental Health, which annually obtains information from counseling center directors, and even the World Health Organization. So we're not talking about just the US, we're talking about national and international research. We're finding that this is a significant concern for our college students. And what we find is that, again, emotional distress has really increased for this group. Depression, suicidal thoughts and attempts, use of substances has increased. And if you look at the data, anxiety has doubled from 10 to 20% within the past 10 years. The number of students considering suicide has doubled. Students are so distressed that we have gone from 31% to recently 42% saying that they are unable to function. And again, this is also occurring internationally. So a recent study has shown that 1/3 of college freshmen internationally report that they had significant emotional distress and concerns just prior to entering college. So this is national and international. And while it may seem that it's new, and we talk about it in terms of being a crisis, actually, when we look at the data, this is actually a 20-year trend. So this has been moving up for about 20 years. What is new is that students are currently flooding college and university counseling centers. So that's a newer thing that is going on. So people are saying, well, what's going on with students? We think a number of factors could be happening in terms of potential societal changes. Some people are talking about social media where students have many followers and friends online. However, they're not interacting with each other together. When we look at 18 to 24-year-olds, we say that this is Generation Z, and we say this is one of the loneliest generations that we have ever seen. There's lots of academic performance pressure as they look forward to the future. Again, the financial concerns. And perhaps it's also a reflection of what's going on in terms of adults. Just generally, a recent study looking at happiness in the US showed that more adults say that they're miserable now than they used to be several years ago. So while we do talk about it in terms of being a crisis, we might say that this is perhaps the new normal. And our college population is increasingly diverse in terms of race, ethnicity, gender, sexual orientation, immigration and citizenship status. So we have more students coming from marginalized communities. There's less research, however, regarding the mental health concerns for these students. And we do find, though, that the emotional distress is increasing for these students from marginalized communities. And in fact, it's not uncommon that the students from these groups exhibit distress at higher rates than those of their white student peers. So if you look at one recent study coming out of California, we see that the African American, Latinx, and transgender students with those varying identities found that the anxiety rates were very high, and they became even higher as they became closer to graduation, and they're looking at what's going to happen in terms of that life transition. So if we look at the number of college students, there are about 20 million college students, and about 40% of them are people of color. That's a lot, and that's gone up a lot in the past few years. About 14% of college students are African American, about 34% of traditional college-age African-American students are in college. And actually, African-American women are one of the highest enrolled groups in college of any group in terms of gender and race. And within the past 40 years, we've seen an increase in enrollment of Black students in predominantly white institutions. And again, they are, at this point, about 20% more likely to report psychological distress compared to their non-Hispanic white population peers. And the lack of research is concerning. We've seen some significant suicide rates increase, especially with young African Americans with children, early adolescents, and especially among Black males. While for African American women, they tend to have one of the lowest rates of suicide of any racial or ethnic group. Some recent research has been conducted to look at the mental health of African American and other students of color. And so we can look at the research that's been done in the collaborations between the Steve Fund and the JED Foundation. The Steve Fund's focus is to look at mental health and well-being for students of color. It encourages higher ed program development and encourages very well accessed good campus mental health services. While the JED Foundation has a very comprehensive public education, public health approach to addressing mental health concerns for students within colleges and universities. And so they did conduct a study a couple of years ago about college students of color. And it's interesting to look at the results. Now, I know you can't see this. I'm just showing you this because this shows you kind of the infographic that came out. And so you can go to the Steve Fund and see the actual infographic, but it's very colorful and it has a lot of information, which we'll talk about now. So in terms of feeling academically prepared, the information from this research showed that African American students were less likely to feel academically prepared than white students. They were less likely to feel emotionally prepared than white students. Their perceptions of the environment were quite different, with African American students feeling that their perception of the college environment was not as good as for white students. They're more likely to feel overwhelmed, more likely to feel angry. And in terms of a sense of control, African American and white students felt about the same amount of control, but for Hispanic students, they felt less control. In terms of college expectations, Black students less likely to feel that college is living up to their expectations and more likely to consider transferring their first semester than white students. So certainly that is a great concern when we look at retention and graduation rates. In terms of actual treatment, Black students received less mental health treatment. And when you look at anxiety, depression, self-harm, you can see the differences there in terms of the amount of treatment that the different groups are getting. Now, really, when you look at those numbers, maybe you think everybody should be getting more treatment when you look at those numbers. But again, the African American students are getting treatment less likely than white students. They're also less likely to disclose their concerns than white students are. And in terms of coping skills, they're more likely to use spirituality and religion than any group. And in terms of alcohol use, they're much less likely to use alcohol or expect it to be a big part of their college experience than white students. So generally, as we look at the Steve Fund, JED Foundation survey and other surveys, you'll see that African American students often say that the racial climate is poor, they're feeling overwhelmed, there's some sense of isolation, and they also get discouraged by feeling that when they do have a concern, that there's a one-size-fits-all kind of approach to their concerns on campus, and that is not fitting for them. When we look at retention and mental health, graduation rates are lower for African American students and oftentimes for many students of color. And again, they're less likely to receive services with similar rates of psychological illnesses when we look at racial ethnic minority groups. And again, this is of concern because we do know that receiving campus psychological services can be very helpful in terms of promoting retention for our students. And we all want a vibrant, engaged campus community. We want to, we're talking more about having a campus culture of caring. And so we want students to be engaged, not only on campus in general, but in terms of their own self-care and mental health. So let's look just a little bit of what we might do in terms of encouraging students to use mental health services, some of the challenges that we see. Some of the challenges include the attitudes that Black students might have towards mental health services. They tend to have less positive attitudes, and they're less likely to know somebody who has actually received professional help, which impacts the degree to which they're willing to go see somebody. They're less willing to disclose information. They're more likely to express some lack of confidence in mental health professionals. And so these negative kind of attitudes and the experiences that they have impacted their just basic recognition of the need for help and usage of the various services. When students are seen, African American students, they're less likely to have received a psychiatric diagnosis, although their behaviors may be similar to their white student peers. So for instance, in terms of suicide attempts, they might be about the same. So we're trying to figure out what's going on. You know, is there actually less prevalence? Is there some kind of disparity in terms of access to treatment? Is there different symptom expression? Are clinicians misinterpreting or missing signs? When we look at African American, Hispanic, Asian Pacific Islanders, they may report fewer symptoms and less likelihood to have been diagnosed. But again, the behaviors in terms of mental health concerns are similar, and it's sometimes greater than white students. And there are some complexities in terms of the interaction of race and ethnicity and these various symptoms. And what the research is suggesting is that clinicians are probably missing signs and not diagnosing accordingly, but missing kind of what's going on. So how can we address negative attitudes and stigma? Because African-American students are more likely to express a sense of stigma around mental health, mental illness kind of concerns. So one way is to look at providing more just basic mental health literacy. So providing more basic information about services and how to access services, providing outreach for that. Providing education that doesn't require personal disclosure. So students can get involved, get information, but they don't have to disclose things that are uncomfortable to them. And as well, to look at developing anti-stigma kind of campaigns, because they are, again, more likely to express stigma regarding mental illness. Now, this is from the Steve Fund. And so I encourage you at some point to look at the Steve Fund. They have lots of information, research. There's a toolkit you can download that can help you in terms of providing information that is anti-stigma. So this is one of the things that they have in their toolkit. So this is a picture of Jay-Z. If you don't know who Jay-Z is, he is an entrepreneur. He is a business person. He is a big music producer. He is a hip hop artist, so he has a lot of influence in not only the Black community, but I'd say in the entertainment kind of community in general. And most importantly, he is married to Beyonce. So he said has actually undergone therapy. And so this says mental health, trauma is rampant. As scared as Black folks are of the cops, we are even more scared of therapists. And as you grow, you realize the ridiculousness of this stigma. So I think that this is a very powerful message coming from a Black man who many people do admire and see as an expert in the community. Another area to look at is cultural mistrust. And this is basically apprehension about the beliefs and experiences about inequitable systems. And this can be measured. And, you know, there's a reason for this. There's been a long history of bias in psychology, and persons of color have been over-pathologized. And this isn't just old stuff, this is new stuff. So a recent survey of some faculty beliefs showed that as they rated the degree to which they thought that students would do well in school, that they first rated white students, then Asian students, and African-American students came in third. So this is discouraging. And especially when you think about only about 25% of faculty are even people of color when we look at the college communities. And then we also have one about stereotypes that college students believe. Again, some similar kind of stereotypes. This one looked at African-American women. They said that they were loud, they were domineering, they're less educated. And I thought the less educated piece was interesting, especially when actually African-American women are the ones who are more likely to be in college than any other group. It's kind of interesting. But certainly it lends itself to a sense of distrust. One person, a researcher, did a very interesting experiment where they developed a video that was that consisted of some African-American experts and mental health, some trusted experts, to talk about cultural mistrust and ways in which to feel better about the psychological process. It was only a 10-minute video, but when they actually measured the students' reaction, actually the level of mistrust went down. So there are ways in which to actually address this, to address this cultural mistrust, and certainly to address the discrimination that occurs for African-American students. If we look at FBI reports since 2014, we see that there's been a significant increase in hate crimes, and the African-Americans are targeted in almost half of those incidents. And unfortunately, some of those incidents have occurred on our campuses. Another area to look at is race-related stressors. And perhaps you can see how students have race-related stressors based on the things that we just talked about. African Americans report frequently encountering race-related stressors in terms of healthcare disparities, a negative campus environment, problems in the legal system, housing, et cetera. But oftentimes, these kind of concerns are not addressed in therapy, and certainly my guess is many people do not teach anything about addressing race-related stressors in terms of conducting therapy. But what we find in terms of measuring it is that it is a significant threat to African-American mental and physical health. And it actually results in anxiety, depression. It actually results in decreased academic performance. So it has a very negative impact, and it doesn't even have to be experienced directly. This can be a vicarious situation in terms of its expression. But students can feel it presently, and it can go on longer in terms of its impact. Some ways in which to address discrimination and help in terms of race-related stressors is basically to acknowledge that this exists. And sometimes it's hard for people, but it does exist. And to encourage students to talk about it, to bring it up, to encourage students to engage in self-care, and perhaps to help them find some ways to respond to the discrimination and race-related stressors that they've encountered. I saw a really interesting brochure that was on the Brown University website for their counseling center that talked about race-related stress. Provides a lot of information, and the fact that it's actually on the counseling center site, and I believe it's actually probably developed by the University of Illinois Champaign, really tells you something in terms of what students can talk about and express in those counseling center situations there. Some ways in which people try to address this is those stressors, especially within a family, is through racial socialization. And so most families will socialize their African-American children in a preparatory manner about the impact of race and the impact of their identity, and eventually how to handle racial interactions and potential trauma. This is really particularly salient during adolescence, because at that point, the children are going to be more independent, they're going to spend more time away from their parents, and so they may unfortunately encounter some situations with the parents not there, where they have to deal with some very stressful kind of situations and learn how to address those. So racial socialization is basically education and protection for students. And we can see that this can certainly have saliency for our college students, maybe even more so for our male college students oftentimes, who have already said that they're experiencing a poor racial climate, that they're feeling isolated, and they don't like the one-size-fits-all response to their concerns. One example of racial socialization is what's called the talk. So oftentimes people will say the talk, and you think about kind of the birds and the bees, and so most people, my guess is most people do the birds and the bees talk. However, for African Americans, there's also the talk, which deals with racist events, dealing with a potentially biased system, dealing with concerns that may happen in terms of a legal system and being given very specific information about how to behave and what to do and how to speak and how to present yourself in a way in order that you can survive a system that might be kind of negative and dangerous and threatening. And so if you're interested, you can look up the talk online. You can see videos of people actually doing the talk. There's a PBS show that talks about talk. And I think it's interesting to look at it because it really gives you, it's very poignant to see how people are very emotional in terms of providing the talk to their children. Stereotype threat also can be a concern for students, as well as the imposter syndrome. Imposter syndrome is one that talks about feeling a sense of incompetence or a fraud, and it doesn't matter about your true ability. You just feel that maybe I don't belong. And interestingly, for African American college students, the imposter syndrome has been associated with some additional layers, such as survival guilt, for feeling like, wow, it looks like I'm making it because I'm in college, but then feeling a sense of guilt about that, or knowing about those stereotypes, kind of similar to what you might see in stereotype threat, and feeling that in addition to being an imposter, I need to kind of prove myself despite those stereotypes. And it's interesting, I just saw recently that at West Point, that 34 African-American women for the first time graduate in a class at West Point. That is really significant in terms of gender and race, and it's the most they've ever had ever since their, 200-year history. And so I saw them talking to some of the students, and so obviously they were happy that they had graduated and felt good about that. But part of what was interesting to me was to hear some of the things that they said, which really fit in right along with the things that we're talking about in terms of having felt isolated and in terms of worrying about could they actually do the work and did they deserve to be there. It fits so much in terms of what we're talking about here. And some of the communal things that are of value to many African Americans in terms of feeling that they had to develop kind of a sister circle that would help them and support them. Because as we look at African American college students, they are more likely than white students to find some kind of a support system or try to find a group that they think will help them to succeed as opposed to just doing it individually by themselves. Racial identity is another area to be aware of. And that's basically looking at the degree to which one identifies with one's race. And if you look at the research generally for African Americans, that those who are more likely to identify with being African Americans or feel good about that source of identity are generally more likely to have positive mental health. And the whole racial identity area is particularly salient for persons who are coming from marginalized groups because they have to, in many situations, keep being reminded of what their racial identity is. So it's helpful to have some awareness of those models. It's helpful to know also that there are some points in this model where a student of color may not want to work with a white therapist. And to understand that, and maybe that means that you need to move that student to another therapist. And explore with them what their identity means to them, as well as explore what your identity means to you. So that'll give you some empathy for that. Some other coping styles include African-centered coping styles. There are some worldview differences between African and European worldviews in terms of the values. So if we look at an African worldview, we find that there is some emphasis on cooperation, inclusion, spirituality, survival of the group. And so one proverb that fits in with that viewpoint is, I am because we are. Whereas for European worldviews, we see more of an emphasis on individualism, on exclusiveness and competition. And so survival of the fittest might best describe the values associated with a European worldview. And research around the African-centered coping styles has found that for those students who fit in with an African-centered worldview, who really endorse that worldview for themselves, that students who can have African-American coping style strategies, that those strategies are more helpful for them and that they align with their values and that it is helpful for their mental health. So if you look at those coping style strategies listed there, especially the ones around the collective-centered rituals, spiritual, and some of the research that I've seen, it seems like the spiritual keeps coming up over and over again in terms of being one of the most salient pieces of helping students for their coping strategies. And the spiritual piece doesn't mean necessarily religion, but spirituality in terms of a sense of connection. It could be a sense of connection with the creator. It could be a sense of connection with ancestors. But it seems to promote problem solving and a sense of hope for many students. Just some resources around an Afrocentric worldview. You can look at the work of Utsi, who was mentioned in the previous slide, Dr. Linda James Myers, who's at The Ohio State University, that has lots of information about this worldview. And she's a psychologist, and she works with people who follow the optimal psychology, belief systems analysis work will conceptualize from this worldview. You can see some short videos where she talks about it online. There's, again, the focus on spirituality, the group orientation. It's a culturally specific approach. If you're familiar with Kwanzaa, and if you're familiar with the 7 principles at all of Nguzo Saba, you can see that those principles are part of this system, this part of this conceptualization and working with students. And again, many of those principles will focus on unity and cooperation and working together. So now let's get to the third part, where we talk a little bit about the University of Akron Counseling and Testing Center and African American student engagement. So our mission statement is to, in summary, is to provide comprehensive, culturally competent or culturally responsive psychological services for our student community. And University of Akron is a public institution of about 20,000 students, many of whom are commuters. We also have a res hall community that's very vibrant and award-winning, and so in graduate school, law school, et cetera. In terms of cultural competence and responsiveness, we try to work from a culturally competent and responsiveness viewpoint. And that means that we're looking at the awareness, knowledge, skills in terms of working with a variety of students. And we try to see that we have a heterogeneous community, and we acknowledge that heterogeneity rather than using, say, a colorblind approach. And again, you might remember that African-American students were saying, well, they didn't feel good about this one-size-fits-all kind of approach. I think sometimes that people will say, well, I'm colorblind and I don't see color and I'm just going to treat everybody the same. But to do that in many cases is to, well, it just doesn't happen. And I think that people do it out of a sense of trying to be helpful and say, I'm going to treat everybody the same. But what we try to do is to acknowledge those differences and say that there are unique characteristics associated both within groups and between groups, and that we want to treat people fairly as opposed to treating them all the same. So I think that's part of what we look at. We also try to work from a sense of cultural humility. And that means opening yourself up to your own identity, being aware that your identity, your experiences really kind of limit your awareness of other people's experiences and their culture, and being okay with that. It's okay. And that we try to challenge our biases. We try to be respectful of other cultures, avoid assumptions. This is something, it's a learning process. And so basically, we encourage people to be lifelong learners and to be humble in terms of what they really know, in terms of working with various students. And we try to be collaborative in our counseling services as well. So while I would say that certainly the people in the Counseling and Testing Center have areas of expertise in terms of content areas, I think we try not to just be the expert as we work collaboratively with people, so that people can be kind of the expert in their own lives. We also try to work from a social justice framework in terms of valuing equity and rights and the treatment of marginalized groups, and understanding the impact of systems on a larger level. And sometimes social justice means doing some kind of action. There, you can look at it in terms of a micro level, which is working with individuals and families. For us, it's probably more likely to be like the working individually with students and groups. Meso level, in terms of more of the prevention kind of work that we might do. And the macro level actually looks more at social structures and policies, and potentially having input and potentially promoting some change. Again, those are some authors there that you might look at if you're interested in looking at more information about there. Vera and Spite have many resources, and actually Spite is in the psychology department at the University of Akron. This is from the American College Association, and just gives you a nice way to conceptualize the work of multicultural and social justice and how it might interact together in terms of looking at ourselves from the various identities we may have in terms of whether we're privileged or whether we're marginalized. And most of us aren't either one or the other. We have different parts of ourselves that fit in here. And we look at our clients in the same way. And so hopefully those of you who may be looking at this who aren't counselors or providing mental health services, if you're faculty, if you're administrators, student affairs professionals, that you can see yourselves here in terms of your different identities and how they interact. We have the attitudes, the beliefs, the knowledge, the skills, which is basic information that we need to use in order to be multiculturally competent. But then we had an added piece here in terms of action, which fits in a little bit more with the social justice piece. So you can see how there's so much complexity here in terms of the interventions, looking at the worldview, et cetera. So hopefully this also gives you an idea about the whole impact of being humble and having some humility, because there's a lot going on here. And we can miss a lot of this if we're not careful. This gives you some idea of the way students are using our services. So on the right is the percentage of students in that particular racial ethnic group, and I'll say what those are because it might be confusing. And on the left is what we actually see in the center. So for African American students, currently the percent of African American students at the University of Akron is 9.5%. And in terms of our numbers at the center, we're seeing about 16.3% of our population are African American. And you can see some similar kind of numbers in terms of the next is looking at American Indian, Native students. Next, we're looking at Asian students. Hispanic, multiracial, and white students. And so what we've typically found is that the population of students using our services are either mirror what's going on proportionally at the university, or in terms of students of color, we're actually seeing more. And so we hope that some of the things that we've been doing has been helpful in terms of students using those services. Okay, racing. Some of the things that we've done, again, try not to use that colorblind approach. We try to encourage students in terms of looking at their strengths, coping styles. Sometimes this might result in an African-American student deciding that they want to get involved in some political activism or leadership. And again, if this happens, we have to know that that can exacerbate the stress actually that they have, because that means they're probably going to encounter more microaggressions. So we need to be aware of that. We've been using more groups lately. And again, I think this taps into some of the communal kind of experiences and support that's helpful for African-American students. Actually, I've been a little bit surprised in terms of just our general groups, the number of Black students who've been using them. But that's a good thing. And we also see that our Black students are using groups that look at intersectionality of identities. So for instance, our LGBTQ plus groups, et cetera, we are getting Black students who are involved in those groups. We've had in the past a Black male support group, which was only really interesting because we had that conducted by a clinician as well as an African-American professor in another department, totally unrelated to anything with mental health or psychology. So it was more a series of workshops. It wasn't a therapy group, but it was helpful in terms of the stigma piece, because he was able to bring in students and he wanted to help them. And it wasn't just two clinicians talking about student concerns. We have culturally specific workshops, for instance, for Black women that deal with body image and colorism, and how you wear your hair, if you wear your hair in a natural style, and some of the identities that may go on with that. So we have workshops. And sometimes what we find is that students will attend some of these workshops that may feel a little less personal, and then they will move into more of the personal therapy kinds of work that we do. We try to have diverse staffing, and in terms of that, I think that we've been able to get diverse staff through word of mouth. People have looked at our webpage and said that they felt that it told them that we had some interest in cultural responsiveness, cultural competence, and so that encouraged them to apply. Another way to try to get diverse staffing is what I call raise up trainees, as we've been very fortunate to have a significant training program. We have an internship, we have practicum students, and so sometimes raising up trainees helps in terms of having trainees come back. And helping with our diversity, as well as they go out into the world and having national connections to tell people about us so that they may feel comfortable in terms of applying for us. And then we also conduct research, and a number of the research topics that we have worked with have actually focused on some area of diversity or students of color. We do diversity dialogues periodically, probably a couple of times a month. And so we talk about issues that are going on campus, and out in the world, among ourselves, and try to express some vulnerability in terms of the diversity. It's like a growing and enriching kind of experience. Not always comfortable, but it's from discomfort you get growth. We get out of the office a lot in terms of doing prevention and outreach work. And I think that connecting with others is really, really important. As we connect with others on campus and they get to know us, those people, especially as we work with groups that work with students of color, they can get an idea of, maybe we can refer students to them. They seem like they would be a safe place for my student to go to. So we do those kind of connections. And we also have a lot of different topics that kind of tell a story, and I think in terms of our in-house college survival kits. How much time do I do this?
Like 10 minutes.
Oh, okay.
5 minutes.
Okay. Just briefly, this is a program that we did. This was some years ago, like maybe 10 or 12 years ago, where we did some work with the Latino community. We had an intern, a Latinx intern. We had some community that was right off campus. We had students who were of Hispanic background, and just basically we did some work with them, and we did some work with the people also in this community. It was a church right off campus. And basically as a result of what we did, we ended up with many people in the Latina community actually seeking admission to the university. And even a year after this student had left, they were calling us, trying to find out about how to get into the university, and we would hook them up with admission. So we feel like this was a really strong social justice kind of work that we did. Finally, just to quickly introduce you, if you haven't seen this, to some information that the Steve Fund has. They do an equity and mental health framework. And so they have 10 recommendations, and each of these recommendations has 3 to 7 implementation strategies that are designed to enhance the mental health of students of color. I'm not going to go through all of these. I have 5 of them up here, and the next slide I have 5 more. You can kind of glance at that and see that they do things. They make suggestions in terms of engaging students, provide feedback, recruiting diverse staff, engaging in various events, providing support for students, and then they give you direct implementation strategies. And so the suggestions that they talk about they're very wide, they're varied, they're at the micro level, the meso level, and the macro level, if you look at it from a social justice framework. But it's certainly worth looking at if you are interested in this topic and in what ways we can provide better mental health services for our students of color. That is all I have.
Dr. Martin, thank you so much. That was fantastic. It was a really nice overview of a lot of topics to kind of consider and things to think about. And then also some really practical strategies and a lot of resources that people can go to. And again, as a reminder to you all, this PowerPoint will be accessible to you all. So thank you so much again. And thank you all so much for your time, and have a great rest of your day. And we hope to see you back in August for whatever our webinar and whenever our webinar will be at that time. All right, thank you all.